A very good evening to all of you. Today we are going to do a radiology MCQ challenge. This challenge will be very useful for you in your NEET PG success. So watch this video again and again till you master the concept. So let us begin with radiology. Radiology has a good chances about 10 questions in NEET PG. Means almost 80 marks. 10 questions in NEET PG, that is about 40 to 50 marks from this section. So let us begin with the first question. Which of the following is the most likely diagnosis of the patient with following chest X-ray? Look at the chest X-ray carefully. Well, you can see a boot-shaped heart. Now look at the options. A. TGA, B. TA-PVC, C. TOF, D. Epstein anomaly. Well, it is a boot-shaped heart. It is seen in TOF, that is tetralogy of Fallot. Again, this tetralogy of Fallot is a very important topic in pediatrics also, medicine also, pediatrics also. Pathology also they can ask. So this topic you should master at every angle. Now, the correct answer here is tetralogy of Fallot. Which sign is seen on ESG when the femoral vein meets the great saphenous vein and femoral artery at the saphenofemoral junction? When the femoral vein meets the great saphenous vein and femoral artery at the saphenofemoral junction, it is a Mickey Mouse sign. So four options are there: Mickey Mouse sign, B. Tilloch sign, stemmer sign, string sign. Now, what do you think is the correct answer? It is a Mickey Mouse sign. Now, what is Mickey Mouse sign? You can see from the image the Mickey Mouse sign. What is Tilloch sign? Anybody please? Tilloch sign. What is Tilloch sign? What is stemmer sign? What is string sign? Okay, tell me what is string sign. Anybody, please. Mickey Mouse sign, it represents the normal anatomy of common femoral artery, common femoral vein, and great saphenous vein on ultrasound. It is a normal phenomenon at the level just inferior to inguinal crease. Just inferior to inguinal crease. What is Tilloch sign? Tilloch sign is a clinical sign. Tilloch sign is a clinical sign in which Tilloch sign is a clinical sign in which there is a resonant area between the pubic bone and tumor. What does it indicate? That the tumor must be mesenteric. Then stemmer sign. Now what is string sign? String sign is seen in Crohn's disease. We all know it is seen in Crohn's disease. Then stemmer sign. Stemmer sign is seen in lymphedema. Skin on the dorsum of toes cannot be pitched due to subcutaneous fibrosis. Skin on the dorsum of toes cannot be pinched due to fibrosis. So Mickey Mouse sign, Tilloch sign, stemmer sign, string sign. So the correct answer here is Mickey Mouse sign. Radiation dose monitoring in occupation of a person is done by A. Linear accelerator, B. TLD badge, C. Gamma camera, D. GM counters. Radiation dose monitoring in occupation of a personnel is done by, we all know it is the TLD badge. Here in the image, you can see the TLD badge. In the TLD badge, you monitor the radiation dose, how much radiation dose is going inside. So it is a TLD badge. What is TLD full form? Anybody please in the comment in the chat box please. What is TLD? Full form of TLD. What is the principle of TLD? TLD means thermoluminescent dosimeter. Thermoluminescent dosimeter. It is a passive radiation detection device that is used for personal dose monitoring or to measure the patient dose. This TLD is used to measure the external individual dose of gamma, alpha, beta, and the gamma radiation. It consists of a TLD card. Here you can see the TLD card loaded in the cassette having suitable metallic filters. What is the principle? The principle is Chemoluminescence. Chemoluminescence. The emission of light when certain materials are heated after exposure to radiation. It is thermoluminescence. When it is heated, it emits light. That is thermoluminescence. So the correct answer here is TLD image. Remote after loading dose. This MCQ is very important. Remote after load dose used in A. Brachytherapy, B. Electron beam therapy, C. Proton beam therapy, D. Cybernetic therapy. It is used in remote after loading dose is used in brachytherapy. Brachytherapy. Identify the given X-ray abnormality. A. Costochondritis. B. Cervical rib. Here you can see an extra rib, that is a cervical rib. So the correct answer here is B. Cervical rib. In which of the lung pathologies MRI is preferred over CT? Well, what could be the correct answer here? MRI is preferred over CT in, here you can see in the image, it is Pankos tumor. In Pankos, it is a MRI of Pankos tumor. MRI is preferred over CT. It is Pankos tumor. The correct answer here is Pankos tumor. DSA angiography image is shown. What is the diagnosis? A. Pseudoaneurysm of internal carotid artery. B. Angiofibroma tumor blush. C. Multiple hemangiomas. D. Carotid cavernous fistula. So what do you think is the correct answer? Well, this appears to be a pseudoaneurysm of internal carotid artery. The image is showing a well-defined outpoaching. There is a well-defined outpoaching from the cervical portion of internal carotid artery, that is level C1. This is typical for pseudoaneurysm, and the image almost remains the same for pseudoaneurysm in any other part of the body. So it is a pseudoaneurysm of internal carotid artery. Which gives a negative test on FDG PET. Now what is FDG PET? Can anybody please in the chat box please type what is FDG PET? The correct answer here is typical carcinoid. Now listen carefully. The FDG PET in carcinoids, bronchial carcinoids, comprise of 22% of all lung malignancies. They are a part of spectrum of pulmonary neuroendocrine tumor of increasing malignant potential, ranging from low-grade typical carcinoma through intermediate grade atypical carcinoma to more malignant and small cell neuroendocrine tumor. So the correct answer here is C, typical carcinoma. Investigation of choice for detection and characterization of interstitial lung diseases. It is high resolution CT scan. Please click in the link in the description box to join the free Neet PG Ultimate Masterclass event. It is a 2-day event. It will be very beneficial for you in making a blueprint for your Neet PG exam. What is the probable diagnosis? Oh, here. Look at the X-ray carefully. A. Thymoma. B. Mature teratoma. C. Aortic dissection. D. Lymphoma. So what do you think is the correct answer? Well, it is a thymoma. It is a thymoma. What is a thymoma? Thymoma is a tumor originating from the epithelial cells of thymus that is considered a rare malignancy. Thymomas are frequently associated with neuromuscular disorders. Which one? Myasthenia gravis. Thymoma is found in 20% of patients with myasthenia gravis. Once the diagnosis is done, thymoma may be removed surgically. In rare cases of malignant tumor, chemotherapy is used. General consideration of thymoma is most common anterior mediastinal neoplasm. Mean age of presentation is 52, which is older than teratoma. Most are solid lymphoepithelial tumors of thymus. Some are cystic. About one-third are malignant. It is rare in children, most common around 5th or 6th decade. So the probable diagnosis here is thymoma. A middle-aged patient presents with fever and diarrhea for 1 week and acute onset pain of abdomen for hours. An erect abdominal X-ray was taken as shown in the below. What is the probable diagnosis? It is toxic megacolon. In coarctation of aorta, rib notching is seen. Here you can see rib notching. Can you see? There is a rib notching. It is between third to ninth rib. So the correct option here is third to ninth ribs. A 20-year-old male presented with knee pain on movement and X-ray shows lytic lesion of upper end of tibia. Well, tibia giant cell tumor. Judith view of X-ray is for A. pelvis, B. calcaneum, C. scaphoid, D. spine. From the X-ray you can see it is pelvis. So the correct option here is A. pelvis. Puff of smoke appearance. We all know puff of smoke means moya moya. So the correct answer here is moya moya disease. FAST. What is FAST? Focused assessment with sonography for trauma. Which of the following gland tumor produces hot spot on technetium-99 per technete scan? It is adenolymphoma produces a hot spot on technetium-99 per technete scan. Investigation of choice for leptomeningeal carcinomatosis is A. PET, B. SPECT, C. Gadolinium enhanced MRI. The correct answer is gadolinium enhanced MRI. Which of the following is used to differentiate between epidermal cyst and arachnoid cyst? It is DW1-MR sequence. Which artery is dissected most commonly following arteriography of bifemoral root? It is an inferior mesenteric artery. There is an announcement. There is a 2-day Neet PG breakthrough blueprint event. This is your gateway to Neet PG success. Please click the link in description box to join the WhatsApp group so that you get all the details of the event. It is free but very valuable, highly valuable. I will see you in the event. The seats are limited. Wishing you all the best. Please click the link in the description box to join the event. And you will stay in the WhatsApp group till you clear the NEET PG exam. Radiation exposure is the least in following procedure: A. Micturating cystourethrogram. B. IVP. C. Bilateral nephrostomogram. D. Spiral CT for stones. So the correct answer here is micturating cystourethrogram. Frontal sinus can be best visualized by A. Caldwell's view, B. Waters' view, C. Townes' view, D. Schuller's view. Well, it is Caldwell's view. Cerebral blood flow in an asphyxiated child is best measured by NIRS, PET, radionuclide imaging, MRI angiography. It is NIRS, near infrared spectroscopy. Egg on side appearance is seen in uncorrected TG. An absolute contraindication of MRI is pacemaker. Hampton hump is a feature of pulmonary embolism. Most sensitive sonological indicator of aneuploidy is mutual translucency. The gold standard for diagnosis of osteoporosis is dual energy X-ray absorption. Maximum permissible radiation dose in pregnancy is 0.5 rad.